see my screen and hear me?
Yes, Professor.
Okay. First of all, thanks to the young neurosurgeons for organizing this amazing meeting. Thank you, Salman. Thank you, Mehmet. And of course, thanks very much to Imad. So basically, I'm going to talk not about management. I'm going to talk about policy because I believe policy is a domain of neurosurgeons, especially policy for neurosurgery. And what I'm going to talk about is recognizing traumatic brain injury as chronic and notifiable condition. And this is a resolution we are trying to move in the World Health Assembly. So it started off with me anyway, with this paper came out from Pakistan in 2023, an official paper regarding the state of health in Pakistan, its provinces and territories in 2023. And it talked about the global burden of disease study. And looking at the paper, there was no mention about traumatic brain injury, either in mortality or morbidity. And this started me thinking, and I had a discussion with certain people like Tony Fegacci. And if you look at this document as well, it also does not show in the top 10 diseases anything about traumatic brain injury. But of course, we know that it is different if you look at all over lower and middle income countries. If you look at the motorbikes and if you look at all this, it's very obvious that, and from all the papers which we see, we say that the traumatic brain injury is the most common killer, more mortality than malaria and HIV together now. So obviously it's very important, but all the data we have is extrapolated data. It is not any data which really has been from any place. The only place we know which is collecting data is in Australia. But we know that although it is the leading cause of death, despite this, it is underdiagnosed, underreported, and underprioritized because it is not there in the national health data systems. And we know that without mandatory notification, health system cannot accurately measure or respond to the true burden of traumatic brain injury. We also know that there's evidence that long-term neurorehabilitation and patient narratives show that TBI survivors suffer from cognitive decline, depression, personality changes, and many other problems with their family or caregivers. So declaring traumatic brain injury as chronic realigns health systems to track, support, and rehabilitate survivors far beyond the acute emergency phase. So it's obvious that early data plus notification is better prevention than care. Real-time surveillance is required. Identification of hotspots and high-risk groups is required. Informed allocation of health resources is required. Ultimately, this would lead to smarter investment, improved, reduced long-term problems in the health system. Because there is lack of follow-up care, data visibility, and support, TBI without notification is invisible in policy, which would mean it is neglected. So as I said, the only country is Australia and a few states in the United States, like New Mexico, which are making it notifiable. What would a World Health Assembly resolution on TBI as notifiable and chronic condition achieve? And this is what we are trying to do. It's because a World Health resolution would place TBI formally on the global health agenda, send a signal that TBI matters and that it is a public health priority. It would correct a long-standing policy blind spot. And that would help in early intervention, smarter resource allocation, targeted prevention strategies. It helps quantify and visualize the true burden of traumatic brain injury, especially in lower and middle income countries. So we need to get it classified and so that we can integrate traumatic brain injury into a notifiable disease list to improve real-time data collection, just like reporting infectious diseases. And this resolution will provide a legitimized framework for Ministry of Health to act and implement reforms. It would give access to technical guidance from World Health Organization. It would align donors. It would have potential for inclusion in World Bank and UNDP health portfolios so that there is more investment. And it would encourage countries to involve people with lived experience in helping them and recognize survivor-led storytelling and advocacy as key to driving political will. So, although it's difficult, but it demands a sustained political and diplomatic commitment, but so did past global successes as well, like polio eradication. So, we know that it is important, and we know that what gets counted gets funded, and what gets funded gets fixed. So, it will become from an invisible crisis into a trackable, fundable, and manageable global health condition. So, we started with all these points, engaging with policymakers, building a coalition, and we have made we started with 2, 3 people, and now we have more than 100 organizations who are supporting this program, and we are hoping that we are able to go to the World Health Assembly next year. The Minister of Health, Pakistan, formally agreed to sponsor the resolution, and very, very hopeful now that Central African Republic, Qatar, Ecuador, Tanzania, Ethiopia, Indonesia are going to be helping us in that. The draft resolution has already been prepared as a traumatic brain injury is a distinct global health priority, notifiable, chronic, and preventable. And we know that the World Health Assembly is meeting in May next year, and we hope that we can try and get the resolution there. This was a very successful meeting which we had in Geneva in May on the sidelines of the World Health Assembly, which was very successful. And there were many stakeholders, not only neurosurgeons, but from all areas, all walks of life. And this was last week when we met with the health minister of Indonesia, who agreed to sponsor the resolution as well. And hopefully we'll have now more than one country sponsoring this resolution. We have upcoming advocacy events in Cairo, which we are going to be attending with the help of Program of Global Surgery and Social Change. Then we have an UN General Assembly event in September, where we're going to be working. Then we have the Western Pacific meeting in Fiji. And then, of course, the WFNS meeting in Dubai. And we would request all of you young and senior neurosurgeons, whoever want to be part of this struggle, kindly connect to me so that we can move this thing forward. Thank you so much. Thank you very much.
Thank you. Thank you, Professor, for a very concise and important message to all of us. We are looking for a question in the chat box. We still have probably about 2 minutes. Maybe I will start by asking Professor 2 questions, Professor. Do you think that the emphasis on a mild head injury, which I think also did contribute to some cognitive impairment and do cause a poor performance of a patient to return to work, do you think the current return to work and compensation mechanism is good enough for those patients, Professor?
No, not at all. That's why there were 2 things. We talked about collecting data of all head injuries, anybody coming into ER with a traumatic brain injury, and we have started a pilot project between Cambridge and Northwest School of Medicine in Peshawar to collect all the data. Also, we are talking about persons with lived experience so that they know and that we want it to become a chronic condition, so that it can be looked at and that proper management, compensation aside, I think the management to be able to, first of all, diagnose and realize that this patient has got a chronic injury, and then moving on to compensation, of course. Thank you very much.
Thank you, Prof. I don't see any further question. We would like to thank Prof as usual, and hopefully Professor Tariq and the team would continue bringing this important message to the World Health Organization and become a priority in the organization. Thank you, Professor.
Thank you, with your help.
Thank you, Professor. I pass the session to Mona to introduce our second speaker. Mona.
Yes, hello everybody.